Good evening, everyone. We are so excited that you have joined us for another installment of our monthly webinars from the Department of Pediatrics here at Columbia Children's Health. Tonight, we're talking all about substance abuse in teens, which hopefully you already knew. I'm Dr. Edith Bracho Sanchez. I'm a pediatrician here in the department. I also lead our external affairs team, and I'm going to wait a second for people to join to introduce our amazing panelists tonight. While we wait for people to join, let me tell you about a couple of things. Just a reminder that we are on social media at Kids at Columbia. You can find us on Facebook, Instagram, X. You can also find us on LinkedIn these days, and a lot of you have found us there, and we're so grateful. We also have an amazing Columbia Children's Health newsletter that goes out every month with highlights from our experts on a variety of specialties and subspecialties. And this December, and the link to this will be in the recap from this webinar, so don't worry about getting all the details down, but this December, we are hosting the 11th annual Pediatric Specialty Updates for the general practitioner. I have seen the agenda. It is jam-packed with good information. If you haven't registered yet, I so recommend that you do. The recordings are available after. This is fully virtual. If you happen to be out Christmas shopping that weekend, do not worry. You can register and watch the recordings later. So we will send you that link. And with that, let me introduce my panelists for this evening. And we're so grateful that they have made time for us. So first, we have Dr. Marina Catallozzi, who is an adolescent medicine specialist and does so many other things around our institution that she can choose to tell us more about. We also have Dr. Ryan Sultan with us. He's the medical director for Integrative Psychiatry here at Columbia. You already know who I am. Very quickly, I have to do this, you already know. A very quick disclaimer, the content of this webinar is provided for general information only, should not be relied on as a substitute for any professional medical advice or treatment, and the views that are shared on this webinar are solely the reflection of the expertise and experience of me and our guests this evening. So let's get started. I think there's a lot of interest in this topic, and I want to go to you first, Ryan, if it's okay with you, to tell us a little bit about what's happening nationally. What is it looking like on the ground right now? What are the trends showing? Is substance use among teens increasing, decreasing, staying the same? Where are we these days?
Yeah. So, I mean, I think it's important for us to break down everyone's individual experience, right? That you're having as a clinician, and as a parent in your area, versus what national trends show. And so national trends are not super concerning. Around alcohol use, it's actually kind of been going down for a while. Among teens, there's still concerns about binge drinking. For cannabis use, it's been steady. It's been fairly consistent. The data is always 2 years behind, so we're not really sure about like what it would be in this current moment. But it has not gone up a lot, but we remain really concerned about it, like from a public health epidemiology point of view, because this is something that is changing in our society, right? The views around cannabis are changing, and everything we know about this area is that the views changing or something that's going to actually most likely make youth be more likely to use something because they're going to perceive it as less harmful. And then lastly, vaping. Oh, vaping is like, I mean, we weren't tracking vaping and we just started tracking it, and it's like crazy what we've been seeing. Certainly getting to the personal experience, and I live here in New York City, I feel like combustible anything has gone up a lot, including among young people, and particularly vapes. So frequently that we see those, and they're unfortunately really dependence forming.
Yeah. So interesting that you frame it like that, right? Like what's happening nationally versus what people may be experiencing in their communities. Because if you walk down the streets of New York City, you see things that make you think, oh gosh, this is exploding out of control. And maybe not really when you look at a national level, but that may still be your experience. I do want to ask you about something.
It may still be important too, right? Like
Absolutely.
New York City was struggling with managing cannabis up until pretty recently.
Yeah. Ryan, you just mentioned something, and I do want to hone in on that because there was a recent piece of the New York Times that was really interesting to me about those shifting perceptions of cannabis and how the use may increase because people are perceiving it to be safer. What do you say to practitioners, to parents who are in the audience tonight about how safe versus not safe cannabis is? And as a reminder, you can put your questions in the Q&A below as we're talking and these questions come up. So what do you say about safety?
So I mean, let's concentrate on kids, and I'll sprinkle in some more general stuff. With youth, anything that we know has the ability to be like dependence forming, we get a little nervous about exposure because your brain, right? You turn 18 and you're like, I'm an adult. Well, we all know you're not an adult yet, and your brain neurology like would also support that, and that your brain is changing and developing until 25. Among ADHD folks, that's maybe 30. So your brain is developing, and we think, ooh, we worry about what things are exposing to a brain and what that does. And there is evidence, in particularly in animal models, that exposure to substances, particularly cannabis and nicotine at younger ages, is going to change your brain's architecture in a way that it makes it more likely that you will struggle to manage your use as an adult. So that's a general concern that I certainly have around cannabis use. Other issues around cannabis use safety is it affects your concentration significantly. And so for like kids, particularly on like weekdays, and it's not unheard of for kids to be smoking before going to school. I think that's really concerning because they're not going to be learning much, right? I mean, like it's hard enough to sort of learn anything with that, right? The On a broader discussion of cannabis, how safe is it? We don't really know. And the reason we don't know is that there are four ways you can get cannabis in the United States. You can, maybe five actually. You can have like an old school dealer that comes to your house. You can have a smoke shop. You can have a unlicensed dispensary, like it looks like a dispensary, but it's actually not licensed. We have a lot of these in New York City that have been shutting down. Then you have a licensed dispensary, and then you have like a medicinal place, and they have different products, and there's testing associated with it, and there's a lot of evidence that testing is not actually accurate. That they're misrepresenting the numbers of compounds and the methodologies they're using. So if you guys remember early in the pandemic, a little bit after lockdown, there was this big thing with like lung problems that people were having, and it got associated with a specific like vitamin E acetate that was being found a lot in vapes. And like it's not clear to me that is totally stopped on the part of the companies building these types of things. So they're not regulated, right? So it's really concerning here in New York and elsewhere, because it's often not clear what you're actually getting and using. So that creates another safety concern that I think people have to think about.
Yeah. So not just, the effects that it can have, but really the places that it's coming from and really how not regulated cannabis can be. Marina, I want to transition to you and welcome to everyone who has joined us since we introduced the topic and our experts. We have Dr. Ryan Sultan with us, who is a psychiatrist, and Dr. Marina Catallozzi, who's an adolescent medicine specialist. I want to transition to you, Marina, to talk about the academic setting, because you are someone who works very closely with students. And I just wonder, how is substance use overlapping or spilling into the academic setting? And is that something that you see?
Yeah, thank you so much. And, it's such a delight to be here with you talking about this important topic. And I want to elevate something that Ryan talked about, which is that, there's good evidence that if you delay the start of substance use among young people, even by a year, that you're decreasing the likelihood that they're going to have substance use disorders for the rest of their life, right? So that's why the trends that Ryan is talking about are so important, that like a little later for alcohol use, a little later for other substances. That's what we know. And we know also that once young people start using, it could be sporadic use or it could be severe substance use disorders. And that really depends on the setting where they're using it. And we also know that because of inexperience with it, you can get things like overdoses, like motor vehicle crashes, like sexual contact that they don't want, and then unwanted pregnancies or STIs. And so that's sort of the setting that I think is so important. When you look at kind of the school setting, this is really critical, and this is the part where we can really intervene as a society and a community, and as a community either of caregivers or parents, is that they're using for a variety of reasons, but they hone in on, of course, wanting to share an experience or feel part of a social group. So how else can we create a social group for young people? So I was talking with Edith before about my son being on a soccer team and how everybody's really substance free on that team. And that's a really important part of his identity, right? To relieve stress. And when you think about the academic stress in this day and age, what it takes for young people, what they feel like it takes to get into a four-year college, and just the heightened sense of things, that really is, there's a feeling of like, what other way is there for me to relieve stress? How can we show a good example? So if you're, had a tough day at work and you're coming home and having a whiskey, right? That is what you're showing your young person, as opposed to, let's do some breathing together. Let's go for a walk as a family. Let's cook together, right? Like those sorts of things. Like, what are the other options to relieve stress? Seeking new experiences and taking risks, because we actually know that's part of brain development for young people, the limbic system, right? Like they want new, exciting things to do. And can it be new and exciting and not be related to substances? And then finally, other mental health disorders. So there's been so much of a focus on depression and anxiety. And it is not uncommon for young people who are undiagnosed, who are not in treatment, who are not in therapy, who are not on medications, to go to alcohol, weed, right? Like what a great way to sort of prep for my day if I know I'm going to be anxious, right? Because I'm worried that I didn't prep well for my math test, or I have some social anxiety. Sure, I'm going to calm myself down with weed before school, and then I can't concentrate. And then it's sort of a cycle, right? So that's where we're really seeing this. And I think the other piece of it that's really important to think about is that we know that kids with ADHD who need stimulants to be able to focus, if they are not getting them, they're also likely going to be going to these other substances like alcohol, nicotine, marijuana. And then also because their peers sometimes will see like, oh, look at John, he's now focusing because he started on ADHD meds. Maybe if I actually use that as well, I'll do better in school. And there's no evidence for that, right? Like if you take a stimulant, you're not gonna, if you take a stimulant and you have a child with or a teen with ADHD, you're gonna see an immediate change, right? Like it often, I don't know about you, Ryan, but young people will say like, okay, it was immediate. Like I knew I could focus better if I'm on the right dose and it goes well. But for someone who doesn't need it, it actually can be quite unsafe for them. So
Right,
that's
and it can
where we're
actually
seeing it.
induce psychosis, like
Right.
in its high level, right? Like, and we all exist on a continuum of how close we are to, struggling with something like schizophrenia, like type things, and high levels of certain drugs, can actually push people over temporarily, which
Right.
is very concerning. And we worry a lot about that with kids, and especially young men who are at the highest risk for this. And
Yeah.
cannabis use, in getting back to the safety thing, cannabis use among young people, particularly young men, is associated with multiple fold increased risk of developing schizophrenia. We don't know why, but it is a really strong and reliable association. There's a lot of debate in the field on what exactly it means, but it shows up in too many places for it to not be concerning.
Yeah. I love how you both outlined sort of the reasons, right? Like it makes such intuitive and common sense, really, like why a teen may go to a substance in an academic setting in which they feel perhaps unprepared or stressed, or, are coping with perhaps untreated mental health conditions. So to just hone in on this a little bit more, Ryan, what do you see in terms of how mental health plays a role in teens choosing to use, and how really what has become a crisis, right? I hate to use the word crisis, but it really is a crisis in teens around the country when it comes to their mental health, is playing into substance use. What else? What can you tell us about the data on
Yeah,
this?
so I mean, think about like substance use from like a really foundational level. Like, why are we even prone to this? Like, why are we prone to this sort of issue? You know, and there's a lot of ideas around the idea that, you know, this is that this is our reward pathway that is meant to encourage us to do things that we want to do, right? That reward pathway gets hijacked by modern drugs that we've made that are actually much stronger. For example, cannabis is way stronger than the stuff that was naturally growing. So nicotine vapes are giving you a much stronger version of it. So these things hijack your system, okay? And as they hijack this system that was meant to make you eat more berries when you were a hunter-gatherer, okay? It's now hijacked it with this really strong thing. And what are you doing? You're going to keep looking for it. And a teen brain doesn't have a good prefrontal cortex. Like this part of my brain here, like that's thing's not done developing to like 25, and that thing's like a break. And so you don't have a good break when you're younger. So this sort of sets them up for how they even end up in that situation. But getting to the idea of, you know, what are the conditions that put you at risk? ADHD is very highly associated. I think we already mentioned that. Very highly associated with that risk, maybe because of the lower, you know, maturation or those sort of, you know, thrill-seeking stuff, but they are definitely youth that we got to be concerned about. So like, you know, and a common misconception was that ADHD treatment, which is psychostimulants usually, that we shouldn't give psychostimulants to those with ADHD that we think have a substance use problem. And that's actually been debunked multiple times. In fact, there are even studies where you sort of actively use the stimulant and they show that it actually improves outcomes for people. So that gets into the idea of like, so if you have a risk factor, like such as ADHD, let's make sure we're treating that risk factor, right? Because the suffering also that comes along with an untreated condition, that's the other reason people go use substances, right? So they're going for pleasure or they're going to relieve like a negative experience. And so if you're struggling with depression, you know, you might feel better when you get high. Like unfortunately it doesn't last, right? And then you might want to get high again. Or when you're in a challenging situation as a young person, you may realize that getting high relaxed you a little bit and that it helped you feel better about it. And that's how you handle the situation. That's not a great coping mechanism. And when you're a teen, you still have to learn lots of coping mechanisms. Like there's a lot you have to learn. So really thinking about how to get these people treated. So if there's depression, if there's anxiety, if there's ADHD, really making sure that those mental health conditions are sufficiently treated so that they don't have a ripple effect that increases the risk of someone starting to use a substance and then developing some kind of unhealthy relationship with it.
Yeah. And that makes total sense. And I really do love what you said, Marina, about you know, creating those spaces, right? Where not only are we treating the underlying conditions, but also just modeling and creating spaces for healthy ways to cope with daily life stressors, which we all have.
Modeling
Right?
is the best way you can teach anyone anything, and certainly your children, right? Like,
Yeah.
why do you think when people say, do as I say, not as I do, you sort of look at them like annoyed? Because like it's hard to take them seriously, right? Like, because inherently, if you're not doing this thing you're telling me to do, like it's really hard for me to want to do it. So modeling that behavior, whether it's smartphone use, you know,
Yeah.
which is a whole nother, while we're in the area of substance use, this is sort of, to me, not that far away. Smartphone use, whether it's substance use, or even emotional regulation, right? Like, you know, that's another thing that we're going to model for individuals in the mental health space, and it's still going to be very important in this age group of teens.
Yeah, totally. That modeling. You have to be ready for your kids to sort of hold up a mirror, right? But that is what they do. Marina, I want to ask you, as both an adolescent medicine physician, as well as someone who works with students, as well as the mom of teens, when we talk about substances, right? Just substances in general, what is keeping you up at night? Is it marijuana and alcohol use? Is it new kinds of drugs or substances that are trickling in? Like what concerns you?
It's a great question. I would say it's both what keeps me up at night and what wakes me up in the morning, right? So because I feel like there's so much for us to do. And I think, you know, we've been focusing a lot on alcohol, nicotine, often either in tobacco or in vaping, and cannabis. And I think those are the three that I see most frequently. There are certainly young people who are using other things, that we can talk about more. Um, let's talk about alcohol first, because I think that there's a few things that are really important in my mind. The earlier you start, as we talked about, you're just going to be more likely to drink more as you get older. And if there is a family member who has an alcohol use disorder, it's important to talk about it. Kids recognize everything, like they see everything, they know what's happening. And I think honesty about it is really important because it does, in fact, increase their genetic risk. And we talk about modeling. I also want to say there are parents who, drink responsibly, who talk with their kids, and still their kids could have substance use disorders for lots of different reasons because of those underlying anxiety we talked about or increased stress. So I just want to also, for the parents on the phone or on this webinar, this is not about blame. This is just about looking at things from multiple perspectives and what are the many things we need to do when we think about keeping young people safe. With alcohol, I think one of the things that is most concerning for me is less that young people are drinking every day. It's really that binge drinking. So if you think of a young adolescent cisgender girl who's drinking 3 drinks within 2 hours, that's enough to increase their blood alcohol level to like 80. And with that comes, if they're young, they haven't really made a plan with their friends of keeping one another safe at a party or wherever they're drinking. That's not only gonna, we could talk about cognition and how it harms them over time, but really it's safety at that moment. So getting involved in, a violent activity that they maybe wouldn't have been involved in before, getting into a fight. Injuries, if you're near a subway platform, if you're getting into a car and driving. But really the big one for young people is unwanted sexual activity, and not just for young women, for young men as well. And so the numbers of things we hear happening around that binge drinking. And again, it very much aligns with stress. Like I'm going to take my midterms and then I'm going to go out and drink. It's like almost planned. And if you don't have a community around you, that's really helping to support that. I think we talked a little bit, and just to say that alcohol is something that still is really like on television and in movies, like seen as like, I had a tough day and then I go take a drink, or like we're having a difficult conversation and alcohol is involved in it. And so I think there's an uphill battle for families and for providers against that. The cannabis piece, I think there's a misunderstanding that you cannot get addicted in some way. Like, I can stop at any time, and not understanding sometimes that there is nicotine that's mixed in, kind of what's in it is agravan. Understanding that it can be hard to stop using, and particularly until you have something else to do for stress relief, it can be really hard. And we've seen a lot of cannabis hyperemesis syndrome in the hospital. That is something that did not exist when I was a fellow. And I think it has a lot to do with what's the concentration of THC now. Again, we talked about like not really, the FDA is not involved in kind of what's the level. And so we see patients who are really confused by it. Please, Ryan, yeah, jump in.
Can I join in on this? I'm glad we're talking about this. This is something that we've not started talking about. I'm going to take her comment even further. When I saw my first hyperemesis syndrome, which was, I don't know, maybe 5 or 6 years ago, I went and I did a literature search. Like I do a lot of research, and I tried to find this thing. I was like, what is this? I've never heard of this. I wasn't taught about this. And there were case reports. So we all know that you only write case reports on things. The only way you get a case report published is if it's some crazy weird thing that no one's ever seen. But that tells you how rare it was. Now you think about cannabis today, like I remember when I was high school, when people would like roll something, it would be the skinny little nothing with like a tiny little bit of cannabis. And it was cannabis that was a third as strong as modern cannabis. If you go and buy a pre-roll, there's 2 different sizes, and one of them is a gram. Have you guys seen how big this is? It is an enormous amount of cannabis. And then the vape pens are able to get you higher blood levels of cannabis and nicotine than you could ever do smoking, because they were designed to do that, right? They were designed to prevent withdrawal for people that, we're using cigarettes. That's what their original purpose was, supposedly. But so these blood levels are getting really high, and that is what's setting this syndrome off, because it's either a significant drop in the levels, or it's something related to sort of mixing these different, and it's awful. These people are vomiting for hours and hours and hours and hours in a shower. It's a really, really awful thing that we were seeing a lot of. And to me, it's one of the things that always surprises me when I see cannabis use not changing that much, and it's especially among youth, but I'm still seeing this phenomenon.
Yeah. Yeah. Um, I love both of your perspectives, and how this has changed over the years. I think by the time I trained, like hyperemesis was becoming more and more common. I do remember seeing several cases in residency of teens, boys, a lot of the times, who were hospitalized with hyperemesis from cannabis use. And it was sort of like, yep, he says he's not using it. Then sure enough, he was, sadly and unfortunately. And I take your point, Marina, about the binge drinking so seriously. And I have to tell you, as a general pediatrician, I don't know that I talk about binge drinking enough. I definitely talk about safety in parties, about, being careful about your drink and where you're putting your drink. And, but the binge drinking, I'm not sure that I personally am talking about enough. And hopefully that's helpful to hear for both the pediatricians on the line and the parents on the line who are preparing their kids for college, really. So along those lines, Ryan, talk to us about the conversations that parents and other adults can or should be having with the teens in their lives. We know, again, from research that the teens do listen to their parents. I think sometimes, when I say to the parents of a teen in my practice, let's start talking about this, they sort of roll their eyes and they're like, well, they don't listen to me. But we know that they do listen to you, that they're watching the behaviors that you're modeling, as we talked about. So what tips do you have for parents on how to have these conversations about substances specifically?
I think it's start with most of these types of things. It's as early as you can start talking about them. And then it seems even remotely appropriate, I would start bringing it up. So it's never sort of a dramatic entry. It's not like you're hiding them from these things. Whenever you think that they might be learning about it, I'm almost sure that they know about it from a peer, right? So I really like making it a consistent conversation. One of the things I try to help parents with is being able to put together a narrative that helps them understand, help the teen understand why the parent is actually concerned. So it's not just a rule, but we're trying to make a little more of a, because at that age, kids are starting to develop enough thinking that they can begin to engage in around that and understand why something might be worrying or concerning to a parent.
Yeah. Now, Ryan, let's say, for the sake of, talking about this and talking it through, that your teen at home lets it slip that they've been drinking or they've been smoking weed. As a parent, should you be like, don't do that, never do that? Like, how should you react in that moment? And how do we do it so that we don't push kids away and shut down the conversation?
Yeah, so I think exploding at them, even if that's how you're feeling, is almost never a great solution. It's definitely not a great solution here. Because you're shutting down the conversation. I think that's totally appropriate. You may explode, right? So let's forgive all the parents that have got exploded. Maybe when I'm a dad, I'll do the same thing. I swear, if my kid was smoking weed as like a teenager, I would lose my mind. Like, I'm just thinking about it.
We appreciate the honesty, Ryan.
I would lose my mind. It's try to recover from that. Try to recover from that and start to engage in a calm conversation with them around what's going on. Assume that they're probably going to sugarcoat the information that they're giving you, and you should keep that in mind. I think that the other thing that, like, this is like advice like my mother would give, like, and my grandma, like, I just like to know like what their peers are doing all the time, right? Like, because what their close friends are doing is like probably what they're doing, so that's a way that I always encourage parents to sort of stay as in touch as they can with their youth friend group, because that's going to tell them a lot about how their child's doing.
Yeah. Totally. And it's funny, like one thing that and I find so many parallels between parenting a toddler, which is what I have at home, and a teen, and I don't mean to infantilize teenagers in any way, shape, or form, but I do think there's so many tests that we're put through as parents, and sometimes you just sort of have to take a step back and approach it from a place of curiosity, like where did this come from? How did we get here? Marina, I do want you to weigh in on this because I know, and again, however much you feel comfortable sharing, I don't want you to embarrass your teens in any way, but how are you balancing this at home? Like you have to tell them what your values are, right? And what's safe and not safe. And at the same time, you don't want to shut down the conversation. How are you managing it as a mom?
Yeah, I mean, I think this concept of talking about it when you haven't found out that something's already happened is really important. So sort of like being clear about your values. Like I would prefer for you not to drink alcohol and smoke or smoke weed. And if you do, I am not going to punish and abandon you. We're going to manage this together. I'd rather know than not, right? I would not rather they do it in my house with other kids, right? Like that's not legal. Like it's because I think some parents sort of go to the point of like, oh, I'm going to provide
Going up.
it. I'm going to provide it so that you're here in my house. You don't want to do that because it's really unsafe. But, having sort of set those boundaries, there's a few things I always do. So when you get home, if I'm not awake, you actually have to wake me up to see you. And they know, like, if I see you, I'm going to know if you're drinking or not. And then we'll talk about it tomorrow and we can talk about how that went, et cetera. Or I can be the one you can call if you're worried about your friend, right? Or like, did you make a plan when you go out tonight? Like, those are all things you have to be very um, comfortable with. Now, does it feel, if I find something out, I'm not going to out my kids on anything. They're wonderful and very communicative. But if I find something out, you got to stick to that, right? Like, so if I'm going to be, I can say like, I'm surprised and I told you I wasn't going to get angry. Let's talk about how you want to manage this now. Or, like, okay, thank you for waking me up. I appreciate it because, I can see what's going on. I also really encourage parents to talk. If you're in New York, it's a little harder if you don't have a car. Talk in the car. They don't have to make eye contact with you. It is really hard when you're talking about something intense with a teenager for them to like keep eye contact with you. It's easier to talk when you're not making eye contact. And that is some of the best advice that I got. And I realized, oh, my father always talked to me in the car. And he was like, I was a little bit scared all the time, but we had easier conversations. Or at nighttime, like lots of us have bedtime routines for our kids. Like even if they're like 15, 16, like, you can still kind of go in and check in at nighttime. It's we used to read stories. Now you could say like, tell me something about your day and tell me about your friends. And also always, always be willing to be the carpool parent because you hear it like they are not filtering a thing. They are talking because they're after party or after whenever. Like if you do the drop off or pick up, like you're going to learn a lot because they forget you're there, which is great. You don't want to be part of the conversation. You just want to listen a little bit. And that's really can be helpful. And sometimes your teenager may be worried about a friend of theirs and being able to say like, what's your worry? Well, they drank and threw up. I've never seen that before. That was like, I didn't know what to do. How can I help them? Okay. Like, what are the next steps? Do you feel like we need to talk to their parent or not? That kind of thing. And that can be really nice if they have that on them, like the pressure of that on them.
Yeah.
Just some of my tips. There's nothing perfect in any of these, but these are just some of the things that I think from different perspectives can work.
Yeah, I love that. And I have to tell you, my parents also talk to me, all of us, there's three of us, in the car. It's so good. And I saw something on Instagram the other day, and I don't usually cite Instagram as a source of anything other than this was a personal anecdote that I found really interesting and totally applies. There was a young adult who was saying that her mom was always around and available when she needed to talk, but she wouldn't come to her and say, do you need to talk about anything? She would just bring the laundry into her room and fold it there. And as she got older, she started realizing that her mom would like dump it and start over. Sort of keep talking. And I was like, I kind of love that, right? It's the concept of just being there for the things that come up for our kids. And that is really what we're talking about. Now, if again, anyone on the call tonight has questions, definitely keep sending them on the Q&A. We will have time to answer those. I do want to transition, Marina, we'll go to you for this one, to talking about substance use disorders, because so far we've been talking about, you know, the teens who may use here, who may use there, and how to do so safely and have these conversations. But what are the signs that things have gone from just, I caught you using, to we have a real problem in our hands and there's a substance use disorder that we need to worry about?
Yeah, I think this is a really tough one. And I think just as a pediatrician, one of the first things we always say is like, listen to the parent. If a parent comes to you saying, you know, there's a change here, or if the young person even says this, right? And so things like really, and as I say this, for folks who have teenagers, you may be saying like, wait, but they're already moody, but really erratic behavior, like very out of character for them. Real depression, being very irritable or anxious. Now, some of this can be signs of depression, but as we said before, some young people will treat that themselves by either drinking or using marijuana or smoking. So, you know, sometimes it's hard to tease out, but these are some of the things that we see. Really having difficulty staying focused on a task, doing things out of character, like stealing money out of someone's purse, or lying when they haven't been lying before, starting to become very secretive. Young people always need some private time for a variety of reasons, right? Just so that they can be by themselves, listen to music, whatever it is they need to do. And so, you know, having private space, but always locking their door, hiding things. A change in school performance is always an issue, right? Like where you see a young person who, like, you know, had steady friends, steady grades, who suddenly is not hanging out with any of their friends, not interested anymore in any schoolwork, not wanting to do things like things they used to be excited about, like, you know, going play basketball with friends or seeing movies, sleeping more or less than usual, and missing things, like not getting to school even though they're supposed to. And then that's sort of like more like mood and attitude. And then for the physical pieces, a change in appearance, so weight loss or being more unkempt, or with poor hygiene, bloodshot eyes, things like, you know, a puffy face. Obviously, when we talk about things like opioid use, track marks, things like that, very uncommon. That's more uncommon in teens, but certainly if you saw it. And then just things like shakes or tremors, or, you know, fidgeting more than usual, things like that. And certainly if you find drug paraphernalia, right? And I'm not saying that parents should search their kids' rooms or anything like that, but, you know, if you're, you know, doing the laundry and a vaping, a vape falls out, you know, that's pretty clear, and you want to talk to your young person about that. And you then want to bring that to the doctor. Now, I will say, if a parent comes to me just saying like, do a drug test, that's not the first place to start. Really, the first place to start is to talk to the young person and let them know about their parents' concern. And then also sort of, there are lots of really good tools that we can use for screening, that are particular for young people. And then you sort of figure out together what's the next step, right? Because a drug test doesn't do anything except to say whether or not it happened. It doesn't help you to understand the context, right? Like, is there anxiety? Is there depression? Is there something happening in school with bullying? You know, whatever it may be. But those are the types of things that I look at. And Ryan, if I missed anything, please add in there.
If we're talking about screening, the CRAFT is it's the acronym for it, is a pretty good screening tool. It's actually probably better than the one we use for adults. And so I would suggest to look at that. You know, differentiating between use and disorder is an interesting question. The sense in psychiatry is that these things are defined by, you know, the all-powerful Bible DSM that we have. The criteria were never adapted for kids. They're the same. They're written the same way. So I do a lot of work with large data sets, like national representatives. So we look at stuff based on DSM, and the likelihood that they have a disorder of any of these things is actually pretty low. But the use is like way, way, way higher. And if you look at the ones that are using, this goes for alcohol and even more so for cannabis that are using stuff, particularly like past month, they have many negative correlates associated with them. So they're going to report poor concentration, academic issues, 3-4 times likelihood of depression, increased risk of feeling that they're having suicidal. So even the low level use, because I want to sort of address the idea, I guess, of like my kids using these things sometimes, even monthly, has a 3 to 4 times association of the number of these negative outcomes for youth. Now, is it being caused by it versus is it just that the kids that are at high risk are more likely to use? Not clear. Probably a little bit of both, but sort of thinking of it as a red flag, because when I was thinking about what are the signs and symptoms of that, it's a lot of things that you would think about as just negative outcome correlates for what should be going well for them as a teenager, right? Like their job is school.
Yeah. Along the lines of, their job is school and all the negative outcomes that it can have, even when it's not a disorder, right? Just the occasional use tied to so many negative outcomes. Tell us a little bit, and really whoever feels comfortable answering this question, about school policies, because I really, to be honest, in my practice, it hasn't come up that much that someone is suspended or expelled for using substances. What do you see? What is sort of standard out there that parents and providers should be aware of?
I think most schools have a zero use policy in terms of when they find substances on young people. But that is not the case if somebody is having sort of the consequences of use, right? So if someone's coming in and vaping in the bathroom, et cetera, then there's going to be usually like a negative consequence. Uh, or repercussion versus somebody who's suffering with their grades because they're struggling with like a use disorder. I think schools are sort of more supportive in that way. I don't know if you agree with that, Ryan. And then I would say some of how you see this come out sometimes also is a consequence off school property with other students where either there was a fight or a video of something untoward, but the school ends up hearing about because another parent reports it because they saw it on their kid's Instagram. So those are sort of the ways that I see schools sort of getting involved. And again, they can have very negative consequences for young people.
Yeah. So hard. I wonder, Ryan, if you can give us some recommendations for community pediatricians who are on the line tonight, and later we'll hopefully watch this on our YouTube channel. But what options do we have as general practitioners when we are worried that a teen may be using, whether it's again the occasional use with the negative consequences versus we're concerned about a substance use disorder? What are the best practices here for us as general practitioners, and what are our options?
I would have low threshold for screening, because the likelihood of use for kids in this is, you're 1 in 5 are going to at least be reporting some kind of use. So you definitely want to be low threshold for screening, if not even standardizing it. When you find it, I'll tell you how I roll as a child psychiatrist. So I'm curious how you guys do as a pediatrician at Adolescent Med. Like, I try to level with them. A lot of the youth I work with are using some kind of substance. They're much higher risk for using it. I try to level with them and educate with them about what I'm concerned about and why I'm concerned. I almost never have told their parents about it directly. I just find that, especially with me, if they're like a therapy relationship, I encourage them to tell their parents. And by the way, their parents almost always already know. So it's sort of like a big elephant in the room until we all talk about it. But so getting back to that, yeah, I think that as pediatricians, I think close follow-up, right? Because it's really hard to get someone involved with someone who's good with substance use and having regular visits. So I would have close follow-up with the kid. I do motivational interviewing. It's this technique that everyone should know. If you don't know it, like every clinician should know, and it's useful in almost every situation where you kind of get at the ambivalence, right? Like, how do I ask the kid to start to think about like is there anything bad that's ever happened when, I don't know, like, can you think of that? Right, to get them to make that connection, help them understand why they like their nicotine vape, so that they can maybe, foresee the consequences of that. Um, I think good old fashioned contingency management stuff is not a bad idea. This is the like, it could be a plan that you guys come up with together. There's certain markers that the kid has to meet, and if they don't do that, there are, certain privileges that they do or do not have. If you can make one of those work, I think and you have to find something they're motivated on, right? Like, so contingency management works amazing for doctors with substance use issues and airplane pilots, because if you don't do it, they're going to take your license away and you can't fly, you can't practice medicine. So, you have to think about how to do contingency management, something that they value, that's important to them. And you also want the goals and the markers you set to them to be realistic. You want to set them up to win so that they're, progressively doing better in their goals. And working with them is a longitudinal thing, right? Like, do not expect that they are going to walk out of your office like it's changing their ways. Really, really talking to them over time, because it's going to take them a little while to really let that sink in and consider changing their behavior.
Yeah. Marina, what else? And all of that is so helpful. Ryan, what else would you add?
Yeah, I mean, I think what you talk about with regard to like you're really understanding kind of what role does this have in their life and how much is it either impairing them because of their trying to get the substance or use it, et cetera. How socially has it impacted them? How have there been negative consequences that they really are? I often will say, like, have you ever blacked out? Have you ever, done something you're ashamed of that you wouldn't want to talk about the next day? Even if it's like yelling at a friend, right? Because I think that's part of the motivational interviewing. It's really understanding kind of where is this and where do you want it to be, right? And I agree. Usually the parents know about it. So kind of getting a young person to understand that having your parent on your side with this is actually can be helpful. But also like waiting for the right time for that. For us, we do involve psychiatry pretty quickly. There are certainly programs for young people around things like more intensive substances like opioids, and even some for cannabis use. They are oftentimes not long term. And so for me, finding a psychiatrist and a therapist who's going to work with someone long term with me, seeing the young person regularly can be very, very helpful. So I agree. I wish there were more programs that were more longitudinal for young people, but I think involving the parent, getting a psychiatrist and a therapist involved, and making sure you're maintaining a relationship is really important. And that's something I think that is important, is that particularly for pediatricians, when you have someone you've been seeing since they were a newborn, you don't want to just say like, okay, I'm sending you there and then I don't want to talk to you about it anymore. I think it's part of their health, right? It's part of what they're managing. It's part of how they're dealing with the stress of school. How can you help them find, ways of be successful in this? How can you support the rest of the family who is also maybe going through this with them, younger children, the parents who over time, because that sense of abandonment can be pretty terrible for the whole family, and for the young person who feels like, well, this person doesn't want to talk to me about this anymore. So at least checking in, making sure they're making it to their appointments, talking with the psychiatrist, getting the okay to do that. If there is drug testing, openly doing it to support them in their quest to stop if that's what they want to do.
Yeah. The follow-up, right, becomes so important, and it's so much of what we do in primary care. As we wrap up for the evening, I wonder if you can give us one takeaway for parents in terms of prevention. Let's focus on prevention. And one takeaway for pediatricians. Ryan, I'll go to you first and take your time because I didn't tell you that I was going to ask you that. So take your time. One
I
thing.
definitely know my parent take home one, which is delay when they start using. Okay, like You want to get them to wait till they're 30. I love it. Now we've covered the risk of schizophrenia too. There are so many reasons to encourage them to delay, right? And I lean all into my neurodevelopment stuff. That's one of the reasons I start with that. Really trying to get them to delay. It's not that I'm saying I don't want you to use weed. I just feel like, maybe 30 is a more realistic. And actually, if you talk to my field, we feel strongly that that the age for cannabis use should actually be 25, given the schizophrenia risk in particular that really exists below that. And so delay as much as you can for parents, and just like, it's not that I'm saying no. What I'm saying is I just would like you to wait. I promise you it will still be there. I promise you it's not going anywhere.
Yeah. What about for pediatricians? What would you say?
I think the most important thing is to find the substance use that's not coming directly to you. And so when I would suggest that when you have these regular visits with your like your year visit with teens, really allowing a good amount of time to be socially related stuff. Because that's where you're going to see the adverse consequences of substance use starting to appear. Friendships, interpersonal relationships, scholastics, and then obviously psychiatric symptoms. And when you see those things, don't stop there. Like, those should be like blinking red lights that appear that you're like, I'm gonna like lean into like some questions about substance use now, because I know that that's a major risk factor. Those things are highly associated.
Yeah. Marina, what about you?
I think for parents, I think it's really three things. The first is you're not really ever going to be cool to your child. And so attempting to create a relationship where you drink together or, smoke weed together, or like, I'm the cool parent, it's never going to work. You're still going to be uncool in some other ways. And so I think it's okay to be the adult and to say like, you know, I'm, while I don't agree with this, I'd rather know so that I can support you, right? But I think some parents really feel like, oh, if I just provide it, or if I do it with my kid, or if I'm really open, it's all going to be okay. And the studies don't bear that out, actually. So that's really important. The second I would say is pay attention. Pay attention, and when you notice something about your kid, believe yourself. Like, don't put off like bringing them to the doctor to screen, et cetera. And it's okay if they don't tell you, as long as they're telling another adult, which brings me to my third point, which is like, use your community, right? Like, trust if someone says, hey, I saw this happen, or I think this happened. There's another parent who's worried. It's easy to just be embarrassed and say like, that can't be my kid. But listen and support the other kids in your community as well, and be honest with their parents. So I think those are my three things for parents. It's, you're not your kid's friend. You're not going to be cool. So that attempt's not going to work. Pay attention, and then, be part of the community and support the other kids in the community. And for pediatricians, I think it's sort of the same thing. Pay attention, right? Like, while it's always important to wear a helmet, right? And when kids are younger, that's what I'm focusing on. When they're older, right, you start at like 12, 13, like, hey, are any of your friends smoking? Is that something your peer group does? Like, you're introducing it as early as possible, so that it's not at 15 suddenly like you're barraging with questions, right? They know that you're someone who's going to ask about all aspects of their life. And if you don't ask about it, have a questionnaire that does it, right? So, I think that there's lots of ways. Oops, sorry, my light went off. There's lots of ways to do this, but asking the questions are really important. And if a parent is worried that something has changed in their young person, believe them. And this is one of the things that you have to ask about.
Yeah.
That's my
Um, I love it. I'm really glad that I asked you both for those takeaways for folks at home. I'm really so grateful for your time, both of you, Dr. Ryan Sultan from the Department of Psychiatry and Dr. Marina Catallozzi from our division of Child and Adolescent Psychiatry here at Columbia Children's Health. We will be sending a recording of this webinar to everyone who registered this evening. We also will be sending you links to sign up to exciting things that are happening here, such as our monthly newsletter, our social media pages, and the amazing, amazing CME events for general practice that make it work. So we so hope that you will register, and we will send all of that. Thank you to all of you that joined us this evening, and thank you to our panelists tonight. We'll see you next month, and we'll be sending out the announcement happening next month. It's exciting. We're finalizing it, but we'll be sending it out very soon. So thank you all. Have a good evening.
Thank you, Edith, for this important topic. We appreciate you.